Gabby used her temporalis muscle this morning when she yawned. It is the fan-shaped muscle covering parts of the temporal, frontal, and parietal bones. It elevates and retracts the mandible and maintains position of the mandible at rest. While yawning this morning, Gabby lifted her arms up and used her trapezius, her levator scapulae, and rhomboids to move her arms. The trapezius is the occipital bone, spinous process of the cervical and thoracic vertebrae. It depends on the active region. It abducts and retracts the scapula and elevates and depresses shoulders and extends the neck. The levator scapulae is on the transverse process of the cervical vertebrae. It is the superior portion of the vertebral border and scapula. It elevates the scapula. The rhomboids is on the spinous process of the thoracic vertebrae. There is a major and a minor. It adducts and retracts the scapula. Also, while yawning this morning, Gabby lifted her arms forward to backwards in a rotating motion. She used her teres minor, her subscapularis, her supraspinatus, her infraspinatus. The teres minor is at the lateral border of the scapula, the lateral rotation of the arm at the shoulder. The subscapularis is located at the subscapular fossa. It is the medial rotation of the arm, also at the shoulder. Supraspinatus is located at the supraspinous fossa, abduction of the arm. Infraspinatus, located at the infraspinous fossa, is the lateral rotation of the arm. While yawning this morning, Gabby took a big, deep breath in, using her external intercostals. They are located between the ribs. The fibers run at the right angles to the internal intercostals. It elevates her rib cage. When exhaling, she used her internal intercostals. They are between the ribs, deep to external intercostals. It depresses the rib cage. While getting up this morning, Gabby used her rectus abdominis to sit up in an upright motion. The action of this is flexing the body at the waist. Gabby has also been using her transverse abdominis. It compresses the abdomen and supports her internal organs. It is the deepest layer of the abs. Gabby also used her external and her internal obliques to twist her body to get her legs and herself out of bed. This morning, on Gabby's left leg, to get out of bed, she used her tensor fasciae latae. It is located at the iliac crest and it abducts the leg. She also used her gluteus medius. It is located at the iliac crest and it also abducts the leg. To bring Gabby's left leg to her right leg, she used her gracilis. It is located at the pubic bone. It adducts the leg. Pleasantly brushing her teeth this morning, Gabby used her masseter. It is located at the zygomatic arch and the mandible. It is the prime mover of the jaw closure. It elevates the mandible. After brushing her teeth, Gabby felt a cool rush of air in her mouth. So she used her occipital frontalis, located on the forehead and the scalp, to raise her eyebrows and wrinkle her forehead. Gabby smiled for us after brushing her teeth using her zygomaticus. It is located at the zygomatic bone and the corners of the mouth. It raises the corners of the mouth upward to smile. When walking up the stairs this morning, Gabby used her quadricep muscles, which are the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The rectus femoris is located on the tibial tuberosity via the patellar ligament and the anterior pelvis. It extends the knee. The vastus lateralis, the vastus medialis, and the vastus intermedius are located on the femur. They extend the knee to straighten the leg. When using the bars on the elliptical machine, Gabby used her biceps brachii, her brachialis, and her triceps brachii. The biceps brachii are located on the scapula and the radial tuberosity. They flex the forearm when pulling back. The brachialis, located on the humerus and the ulna, also flexes the forearm when also using the backward pull on the bars. The triceps brachii, located on the scapula and the humerus, the oscleron process of the ulna, extends the forearm when she pushes forward. When using the bars on the machine, Gabby used her teres major and her deltoid. The deltoid is located at the clavicle and the scapula and the deltoid tuberosity of the humerus. As a whole, the muscle is a strong abductor of the humerus. The teres major is located at the axillary border of the scapula, the anterior surface of the humerus. The action of this is abducting and medial rotating of the humerus when pushing and pulling the bars. When on the machine, Gabby uses her gluteus maximus, located on the ilium and the posterior femur. It extends her femur or straightens her leg when she uses a backward motion when working out. On the backwards motion of the machine, Gabby uses her hamstring muscles, which are the biceps femoris, semitendinosus, and semimembranosus. The origin of all these muscles are at the ischial tuberosity of the pelvis, but for the biceps femoris, its insertion is at the fibula. For the semitendinosus and semimembranosus, the insertion is at the tibia. The action for all these muscles is hip extension and knee flexion. When shooting a three-pointer, she uses her gastrocnemius and soleus to jump up. The gastrocnemius is located at the two heads of the distal femur and the calcanesis via the Achilles tendon. It is the plantar flexion. The soleus, located at the tibia and fibula, and the calcanesis via the Achilles tendon also is plantar flexion, to point her toes. When sitting in a parking lot all alone eating chocolate, Gabby uses her digastric muscles, her mylohyoid, and stylohyoid muscles. The digastric originated on the anterior and posterior belly, the mandible, and the mastoid process of the temporal bones, and the hyoid bone. It opens the mouth to put the food in. It involves swallowing and speech. The stylohyoid is located on the styloid process of the temporal bone and the hyoid bone, involving the swallowing of the chocolate. Mylohyoid, located on the medial surface of the mandible and the hyoid bone, forms the floor of the mouth, holding the food in her mouth and not letting it go through the bottom of her jaw. It is also involved on swallowing. It moves the food into the pharynx. Before getting into bed, when reading her text messages and putting on her chapstick, Gabby had her legs crossed. Using her sartorius muscle, located on the iliac spine of the pelvis and the tibia, Gabby crossed her legs to sit. The orbicularis oris muscle, around the mouth, closes and purses and protrudes the lips, while kissing, what she needs chapstick for. The platysma, a thin sheet-like muscle of the neck and lower mandible, pulls the corners of the mouth down and tenses the skin of the neck, as when shaving. It sags with age. Gabby does this when looking down at a bad text message from a boy.